Patrick, and joining us now is clinical nurse specialist Alice Benjamin. And Nurse Alice, we wanted to start with a little bit more on the science. You know, Patrick addressed this to some degree. I think there's also been some new research showing that those folks who are vaccinated are less likely to transmit the virus. Is that part of the decision making that went on here?
Absolutely. All of these guidelines have been based on the science, and the science has been very clear that people who are fully vaccinated are more unlikely to spread the virus or to develop severe illness, which is exactly what we want, and which is the reason why we want you to get vaccinated. But, Carolyn, the science is also clear that for those who are unvaccinated, you are still at risk of developing mild, moderate, or severe COVID illness, spreading the virus, and death. So all the more reason we want people to get vaccinated. This is based on the science, and it comes from the CDC, which is great news, but as you can see, it's led to a little bit of confusion about how we roll out this information.
All right, there's a psychological side to all this, Nurse Alice. Will vaccinated people keep their masks on for longer, either because of judgment, shaming, or for comfort?
You know, I think it's going to be a combination of all of those things. I mean, for the last more than 1 year, it's been ingrained to us. Social distance, wash your hands, and wear a mask. Those are three things that have become staples in our everyday life. So even with the new guidelines, even when we are allowed to implement them in our respective area, I think it's going to take a while for people to actually adopt those. I mean, we have a lot of systems and processes we need to put in place, beginning with our vaccine and immune registry. Each state has one. Each state has their own problems with them, and none of the states talk to one another. So we still have systems and processes we need to put in place before we can fully and safely enact these guidelines.
And this really is a matter of it being an honor system. So we were talking about this earlier. A lot of people who don't want the vaccination also don't want to wear masks. So you just kind of, I mean, what are your thoughts on that?
Well, you know, that's one of my biggest concerns because, you know, some people have been shamed for getting the vaccine, some people shamed for not getting the vaccine. And the bottom line is we want everyone to be safe. And in order for these masks to come off based on the science, it's important that you've been vaccinated. Now, I have my vaccination card here, and it's just a little piece of paper with a sticker and a lot number. So, you know, heaven forbid that someone would try to replicate these. But, you know, we don't want that to happen. But if people are going to be incentivized to have, you know, resume some of their normal pre-COVID activities, I can see where people might do that. So, you know, this will only work with the honor system until we get systems and processes in place. And that's going to take a while. That's not an easy thing. You saw how our rollout went. Yeah. So it's going to take some time, but we'll get there.
All right, Nurse Alice, thank you for your time.
Thank you.
All right, some other huge recovery news here this afternoon.